Hey everybody, welcome back to another episode of Daily Doc Talk. I am your host, Dr. Drew Timmermans. So the last kind of few weeks, I've been talking a lot more about female hormones and kind of some of the different issues that we can have around those. And so I wanted to take a second just to kind of talk about the two different types of estrogen dominance that a woman can have and how treatment for those would be different. And it's important to understand which one is going on, and also just briefly talk about some of the long-term side effects and complications you can have from hormonal oral contraceptives, whether that's oral or if that's an IUD such as Mirena. And so the first thing that's important to understand is that most of these symptoms that women are going to complain about during, kind of their menopausal years or their perimenopause, or even as younger, is going to be an estrogen dominant condition. And so those things, if a woman is having her period still, those are going to show as heavy bleeding, heavy cramping, kind of acne, things like that. A lot of the reasons that women tend to go on oral birth control in the first place. And so when we have this estrogen dominant condition, there's two things that could be occurring in the body. One is that a woman could have a true estrogen dominance, and that would be indicated on the labs as normal progesterone levels and then highly elevated estrogen levels. Or it could be a relative estrogen dominance where estrogen levels are normal on labs, but progesterone levels are really low. And so the treatment for these is going to obviously be different, because in one situation, we need to reduce the overall estrogen levels. In the other situation, we actually need to increase progesterone levels. And so these things can be done through diet and lifestyle methods, but also some targeted supplements and maybe some bioidentical hormones for the progesterone could be indicated. We're not going to talk about the treatments today, but I just want to create this distinction in that estrogen dominance is not always going to be one picture, not only going to be one cause. And so you need to kind of look at why is that happening in the first place, what the underlying physiology is, so that way you can address it appropriately. The other thing that's been coming up a lot for me lately is one of the more common side effects of being on any form of synthetic hormones for a long period of time. And so usually for women, that's going to come in the form of oral contraceptives, and that's a permanently elevated sex hormone binding globulin. So when you take the birth control, you get a big surge and a higher serum level or blood level of your estrogen and progesterone. When that happens, your body responds by increasing production of a protein called sex hormone binding globulin. This protein circulates through the blood and holds on to and picks up excess hormones, mainly the estrogen and the testosterone, because levels are so high. And so it's actually like an innate kind of protective mechanism from not having too high of hormones, because that can cause danger. And so while a woman is on the oral contraceptives, that increases. And sometimes when a woman comes off the oral contraceptives, the body recognizes that and reduces its production of sex hormone binding globulin. However, that's not always the case. And the longer a woman is on any form of birth control, hormonal birth control, the higher the chances are that that is going to be a permanent elevation in sex hormone binding globulin. What that means at the end of the day is that women who have been on oral contraceptives long term are going to be more susceptible to having low testosterone levels later in life, because if the sex hormone binding globulin stays high and that testosterone, the total testosterone, is still normal, then that sex hormone binding globulin is going to bind up a lot of that testosterone. So that means that the free testosterone, which is the testosterone not bound to sex hormone binding globulin, that's actually able to exert its effects and do the work, is going to be low. And so in that situation, a lot of women are going to present with muscle weakness, lack of libido, loss of muscle strength, their mood, they're going to have a depressed, more melancholic mood. Their gumption for life is going to go down. And then obviously a lot of fatigue, because testosterone helps with fatigue levels. And so that's something to just consider if you're suffering from some of those symptoms and you've been on hormone replacement therapy, in the form of oral contraceptives in the past. dealing with an elevated sex hormone binding globulin can be difficult and may require some more aggressive diet and lifestyle recommendations, as well as supplementation, and then maybe some bioidentical hormones to help just kind of outcompete that sex hormone binding globulin with adding in testosterone. But again, each patient's going to be different in how they respond to each of the therapies, and so that's why it's important to work with a physician when you have something like this going on. All right, everyone, thanks for tuning in. I hope you learned something, and as always, I will see you next time.